Initially, after a hip replacement, there are very few restrictions. Traditionally, we've been warned about really low chairs and crossing our legs over. The way we do hip replacements these days, there are very few restrictions. Initially, the bone has to grow into the parts that we put into you. So that takes about 6 weeks. During that time, we would recommend that we avoid impact activities, heavy torques across the hip, things that will put extra stress across those interfaces so that the bone can grow onto the parts. Furthermore, keeping your hip in a position of comfort is a good rule of thumb. Once it heals, after the 3-month mark, we tell patients that there's really very few things you can't do. So if a patient wants to go and be active and hike and swim and do all sorts of low impact activities, we would highly support that. We want a person to get back to their normal functional level. High impact activities are always a little bit of a challenge after a joint replacement and may accelerate some wear, but the vast majority of things and activities for patients are fine.